The CDC warns there's no safe level of exposure to secondhand smoke, and even short periods of exposure can be harmful to people's health. State House reporter Mary Green explains what some lawmakers want to do to reduce the danger to the youngest South Carolinians who may face dangers from these toxins.
According to the CDC, a dozen states have banned smoking in a car when there's a child inside. Now, a bipartisan group of senators here at the State House wants South Carolina added to that list next.
I think the time has come for us to have a serious discussion, having South Carolina join these other states. Many of them are southern states.
Senator Darrell Jackson just filed a bill that would prohibit people from smoking in a vehicle if there's a child younger than 12 inside. It's similar to legislation he first filed nearly 2 decades ago, but Jackson says opposition from tobacco companies and different attitudes about smoking defeated his push. Now he believes those attitudes have changed enough for this bill to pass in 2025.
We have a greater appreciation, greater knowledge of secondhand smoke and what it does to human beings, period. Particularly what it does to children.
Data shows about 1 in 10 adults in South Carolina are smokers, while about 1 in 5 adults in the state are tobacco users.
We continue to see tobacco being a problem with the cost of our state and really just like the number of children and youth who are starting to smoke and the adults who continue to smoke.
The American Cancer Society applauds Jackson's effort and says implementing even more expansive measures like funding for tobacco prevention and control and enacting local smoke-free ordinances would have an even greater impact.
Right now in South Carolina, there's still only 40% of our state that it's protected under a smoke-free policy. That means that, you cannot smoke indoors, indoor workplaces, restaurants, bars. South Carolina has some of the lowest amounts of funding programs that we fund for tobacco prevention and control. And that's also a priority for us.
And under this bill, anyone who violates the smoking ban could be fined up to $100. Reporting from the State House, I'm Mary Green.
Smoking directly costs more than $2 billion annually in health care expenses in South Carolina, according to the Campaign for Tobacco-Free Kids.